and welcome to this short webinar produced to discuss the role of health accreditation schemes in goats. My name is Jessica Hagain. I'm a final year veterinary student at the University of Liverpool, and this presentation is something that I've produced as part of my ongoing bursary from the BGS. And really it just aims to give a brief overview of the current schemes available to goat keepers in the UK, and then I'm going to talk a little bit about each of the diseases as well. At this point I'd just like to say a quick but very big thank you to David Harwood from the Goat Veterinary Society for proofreading through this presentation for me. I hope it's something that you all find useful, and really I just want this to be a tool for you to use to look at the schemes available and decide whether or not it is something that you'd like to look into further for your own herds. Essentially, health accreditation schemes allow us to proactively monitor for disease in a systematic way, and this helps us to prevent diseases spreading through both our individual herds but also the national herd. This also helps us to limit the cost of treating these diseases, as well as limiting any welfare implications on affected animals themselves. As a proactive approach to disease monitoring and hopeful eradication, it is more preferable than a passive approach of waiting until disease is evident within the herd and then trying to treat and eradicate the disease. However, it is important to note that whilst accreditation schemes do have a role in controlling diseases, biosecurity should not be overlooked and remains an imperative part of keeping diseases out of our herds. Our ultimate aim, of course, is going to be to have disease-free herds, but different management systems mean that this isn't a one-size-fits-all approach. So in commercial herds, the main aim may be to do a test and cull policy, with economics being an important factor for this decision. But in our pet and smallholding herds, it may be more important to focus on how to live with the disease and how we can best manage the disease and monitor, with a long-term goal of eradicating the disease further down the line. Again, a lot of emphasis with biosecurity within our herds is one of the main ways that we can prevent disease coming in. The premium sheep and goat health schemes are run by the SRUC Veterinary Services, who provide a framework to establish the disease status of a flock or herd. They also provide guidance for the reduction and eradication of diseases, and then will provide certification of a flock being free from a certain disease. They offer an approach of testing and management for several diseases, including mydevisna for sheep, caprine arthritis encephalitis or CAE in goats, and Johne's disease. They also provide a scrapie monitoring scheme for export and scrapie genotyping. So this is just the home screen on the SRUC homepage when you search for the sheep and goat health schemes. You don't need to be a member to have a look at any of the information on the health schemes, and there's price indications on each of the scheme and the testing as well. So now I just wanted to go through the three main diseases that we can utilise health accreditation schemes for in goats in the UK. The first disease I'm going to discuss through is caprine arthritis encephalitis, or more commonly known as CAE. So this is a chronic and progressive disease. The virus is predominantly transmitted through the ingestion of infected colostrum or milk. There has been some evidence that it can be transmitted through direct nose-to-nose contact as well as aerosol transfer, but really the main transmission route is this infected colostrum. So feeding pooled colostrum is quite a common practice seen in commercial dairy herds. However, it's really important that we remember that whilst we've heard the term many times that colostrum is gold in terms of passive transfer for antibodies, and we focus on getting colostrum into our kids, which we're doing rightfully so, however, in infected herds with CAE, this colostrum will actually be the cause of disease. So this makes the control of CAE in these herds very difficult. So after the initial infection in kids in the first few weeks of life, they'll remain asymptomatic, so they won't show any clinical signs, and this can be from months or even to years before we see any disease. And CAE results in a spectrum of disease presentations, and these can be seen either on their own or in combination with each other. So the presentation that we see in younger goats, so 2 to 4 months old, is a very rare presentation, but it can be seen, and this is incoordination and like weakened legs when they're trying to walk, and we progress to a severe hind limb weakness. Again, it is a rare presentation, and we usually do see the clinical signs in adult goats over 12 months old, and that most commonly is arthritis. So that's what we can see in the photo just there. All the joints are susceptible, however the carpal joints seem to be the most common site, and that's what we can see again in this photo. And the joints will appear visibly enlarged, but they're not necessarily painful when you touch them. So the affected animals will show a really obvious lameness, and this can lead to them lying down more, walking on their knees. So then this reluctance to move around will result in reduced appetite and then obviously reduced milk yield because of that. They can also show mastitis as one of the disease presentations, again on its own or in conjunction with another presentation, and this is progressive shrinking and hardening of the udder tissue, and the affected udder half will progressively decrease in milk production. Another presentation is chronic wasting. And these individuals again can show other CAE infection manifestations, or it can just be an individual that's showing signs of ill thrift. So they've got a normal appetite, but they're just progressively losing weight. So you've got a spectrum there of the disease that CAE infection can cause. So there's no treatment or vaccine available for CAE. So I think it's important for us to look at what then the cost is of having CAE in our herds. So there's been a few studies that I found that looked at the economic cost. So first there was a 3-year study done in Israel who looked at over 240 goats and found that in the first lactation the milk yield was significantly lower in those animals that were seropositive. Another study that was done in Poland looking at a smaller herd size of around 50 goats found that there was no difference in the daily milk yield. However, they did find that there was a significant difference for the main milk constituents. So in animals that were seropositive, they had a lower fat and protein percentage, and this can have quite an effect on commercial dairy goat herds by not being able to meet their milk contract requirements. Therefore, it does have a production cost. I think it's also important to remember that the real big cost with having CAE in the herd is welfare, due to the clinical signs and manifestations that we've seen previously. So we've got a disease where goats are infected early on in life and they're infected for the rest of their life, and it's something that we can't treat. So the only way that we can really control this disease at the moment is a test and cull policy. So with the testing, that's done through a blood sample, and as part of the BGS membership, the testing from the SRUC is subsidised. And we use this testing in order to establish the level of infection within a herd, and from that point we can look at if we need to implement a control plan or not. So the culling of any seropositive animals is our main control strategy, and it has been shown to be more successful if we then also remove and cull any of the offspring from that seropositive animal to reduce the herd prevalence, because they are going to have been infected early on in life and probably won't be showing clinical signs just yet. It's also really important to remember about biosecurity, to test any goats that are coming into the herd. The introduction of just one positive animal into a small herd or even a large herd can be detrimental, as again you're not going to be seeing any clinical disease for 1 to 2 years and they remain just hidden in plain sight. So there's lots of information on the cost of CAE, and I appreciate that's with a particular emphasis for commercial herds. However, there is a bit of a stigma around being CAE positive, especially in showing herds. And it's not something that I really want to dwell on at the moment, but just to take it back to the milk constituents difference, that can still have an effect on smaller herds. And especially if you're showing and you want to get certain milk awards, by having CAE or unknowingly having CAE, for example, you may not be able to reach those awards because the seropositive animals will have a lower fat and protein percentage. So again, of course, our aim is to be disease-free, but it's important to realise that it's not going to happen overnight, and implementing control plans are a long-term management control. So the next disease we're going to quickly go over is Johne's disease, and that's caused by the cattle strain Mycobacterium avium subspecies paratuberculosis, which can also be referred to as MAP. This is another disease where goats are infected early on in life, but then the clinical signs are not apparent for a number of months to years. So transmission mainly occurs in kids under 6 months old, and it's through the ingestion of contaminated faeces, and that can be in feed or water, but also on the teats and udders of the dam when they're suckling. There's also been some confirmed infection in the uterus of dams if they were really heavily infected with Johne's during late pregnancy. So goats over 6 months old do have a progressional resistance to any new infection of Johne's, but it is still possible. So the main infection time, again, is in the younger kids. So with the clinical signs, Johne's is described as an iceberg disease, as any clinical cases that we see are just the tip of the iceberg within that herd, and there'll be many more that are infected but aren't showing signs. The signs can be quite subtle, so the appetite is usually unaffected, but they have a progressive weight loss and a reduced milk yield. As the disease progresses, it can lead to anemia and the presence of bottle jaw, which is what's shown in the image on the left, and that's caused by the pooling of fluid just under the lower jaw, and that's due to a progressive lack of protein in the blood. Now, there's a really big difference between the clinical signs that we see in cattle compared to goats. In cattle, you see this profuse watery diarrhea, but in goats we really don't see that until the end stage of the disease. It's important to note that having bottle jaw does not automatically mean that an individual has Johne's disease, as it's not always seen, and it can be caused by other things like parasites. So don't panic if you see it, but it is a clinical symptom of Johne's. The main difficulty in controlling Johne's disease comes from how the organisms act within the body. So once they're ingested, the MAP organisms will localise in the wall of the small intestine and then are taken up into the immune cells in the body. So essentially this means that the organisms are hidden from the body's immune responses, but are able to persist and proliferate for months to years. So an individual can be infected with Johne's but will show no clinical signs and will have no antibodies, but they can still be shedding MAP organisms in the faeces. So as the organisms continue to proliferate, they will eventually spread beyond the intestine, which is when the body will recognise the disease, and it causes a huge influx of inflammatory cells, and that influx results in the thickening of intestinal walls, and that inhibits the goat's ability to absorb nutrients properly, which contributes to the progressive weight loss that you see without the goats being inappetent. So at this point, the body's immune system will begin to produce antibodies against the MAP organisms, as well as shedding the organisms in the faeces as well. So the length of time for this to occur can range from 12 months to 2.5 years. So that means that MAP organisms can continue to be shed, and they're actually able to survive in the environment for 1 to 2 years, which increases your chance of transmission within the herd. So again, biosecurity is really important to keep Johne's out of herds, and we should try to be looking into purchasing goats from clean herds where we can. There was one case that I managed to find where a closed herd of dairy goats did succeed in eradicating Johne's from the herd, and they did this through frequent serological screening, so that's looking for individuals with antibodies, as well as fecal cultures for the organisms themselves. And they had really strict biosecurity measures. The herd was first confirmed to have MAP present in 1997, and that was after a few years of them being suspicious about it. Following an aggressive testing regime and culling of any goats that had a positive fecal culture, they were considered free from Johne's in 2003. So that shows that becoming disease-free from yonis is not impossible, but it is a long-term goal, and it's not going to happen quickly, and it will take a lot of work, but it is possible. So at the moment, there's no known treatment for yonis. However, there is a vaccine that is available, but it will only reduce the clinical effects of the disease, and it does not prevent infection completely. And it can also interfere with intradermal TB testing as well. So there's been a little bit of work done in respect to production losses, mainly in dairy cattle, but it is transferable across to goats as well. So in 2002, DEFRA found that cows infected with yonis but had no clinical symptoms showed a 10% reduction in milk yield, which when those cows began to show clinical signs had a 25% reduction in milk yield. So that's got huge economic impacts, and it would have huge impacts on the dairy goat industry as well. It's probable that in meat goats, you're going to have increased culling rates due to that early weight loss seen. There's also been some evidence recently about a public health risk to do with yonis. So there is evidence that there is a link between Johne's disease in ruminants and Crohn's disease in humans. They have quite a similar pathology seen in the intestine. So it is known that MAP organisms are not eliminated when milk is pasteurised and have been identified in milk produced for human consumption. So there has been a few cases of MAP organisms being identified in humans with Crohn's disease. However, the general belief was that Johne's disease is not zoonotic. But some literature does suggest that a major difference between Crohn's disease and Johne's disease is that the organisms are not readily identifiable in Crohn's disease. But MAP organisms are also extremely difficult to culture to allow for diagnosis. So research into the potential relationship between Crohn's and Johne's disease is a really big area of interest at the moment, and there's quite a few studies. One that I found was done through the EU Scientific Committee on Animal Health and Welfare, and they concluded that the current available evidence is insufficient to confirm or disprove that MAP is a causative agent of Crohn's disease. So the current belief that if MAP is involved in causing Crohn's disease, there's a number of susceptibility factors involved, and it's not necessarily a direct cause and effect. The last disease we're going to look at is scrapie. So scrapie is one of the transmissible spongiform encephalopathies that affects both sheep and goats. It's on the OIE's list of notifiable diseases. It's thought to be caused by the expression of abnormal forms of proteins called prions. So prion proteins are found throughout the body, but their main role is to do with the nervous system. So the replication of these abnormal forms of prion proteins is what contributes to the clinical presentation of scrapie. So typically, transmission occurs in the uterus, and it's either through the placenta or intrauterine fluids. There is some evidence of adult-to-adult transfer from infected to naive individuals, and that's through the ingestion of contaminated fluid at kidding times. So I'm sure everyone will have probably seen that goats rapidly eat their placentas after they've kidded, and if given a chance would probably eat the placenta of another goat that's just kidded. So you can see how that can contribute to quite a rapid spread in a group housing environment at kidding. So, clinical signs, it's a disease that has a long incubation period before clinical signs are shown. So it can be from 12 months to 5 years. And early on clinical signs are often missed, and they just tend to have like subtle behavioural changes, and this can progress to difficulty in balance, in coordination. They tend to stumble when they walk, to compulsive rubbing or scratching of the body and fleece, which is what contributed to the naming of the disease, but it is less commonly seen in goats compared to sheep, and that's the image that we've got just there. So that's where the fleece has been rubbed off through this continuous compulsive scratching. So more commonly in goats is a gradual loss of body condition, and their response to sound and other stimuli can be quite exaggerated, and they sometimes get an increased nervousness or aggression to things that before wouldn't have bothered them at all. So infected individuals will also often isolate themselves from the rest of the herd, and eventually in the later stages they will become recumbent and they will eventually die. Again, scrapie is one of those diseases that we have no treatment for, and affected individuals are often euthanised on welfare grounds. As a notifiable disease, any case where there's a suspicion of scrapie has to be reported to the local APHA, and that's done via your vet, and then the local APHA will then instigate any next steps that are necessary. In terms of production costs, there's production losses through meat and milk production. There's also a loss of income due to not being able to export anymore if that's something that you would do. And you've also got increased disposal costs from the euthanasias that have to take place. So within the sheep industry, there's a really well-established control method of genotyping sheep, and that's essentially to look for the prion gene that encodes for the abnormal proteins. So this method has allowed sheep farmers to be able to breed for scrapie resistance effectively within their flocks. However, the identified genes involved in resistance in sheep are significantly different to those in goats. However, there has been some recent research performed by Goldman et al. In 2016 of a genotyping survey of over 1,200 goats in the UK, with the scrapie-resistant gene being found in 8 heterogeneous individuals. So while this number sounds really low, it means the possibility of breeding scrapie out of the UK goat population is not impossible. So for a disease with no treatment and no other control except culling, this is something that as goat keepers we should really be aware of and continue to take part in. So that's just a link to the article there, and it's open access, so you shouldn't have any problems accessing it, but if you do, feel free to contact me. So, as previously mentioned, the SRUC Veterinary Services offer a proactive approach of testing for CAE and Johne's disease. So in order to achieve this accreditation status, they request that you do 2 qualifying tests. So your first test will be on all animals over 12 months of age, including billies. You then need to do a second test that's repeated 6 to 12 months later. So if both of these tests are passed, you will have qualified for CAE accreditation status. For any larger herds, the proportion of animals can be tested if it's not feasible for you to test everything over 12 months. And there's a really nice table on the SRUC website that documents the proportion pending the size of the herd. So there's also some further criteria that you've got to meet as well. So that includes the herd being established for a minimum of 3 years, a minimum of 90% of the breeding females to be homebred. Any purchased animals from the last 3 years need to be from CAE accredited herds, and there can be no other animals on the holding that are going to remain non-CAE accredited. So you cannot just do a proportion of the animals on the holding that you want to have a CAE accreditation status. So in order to maintain that status, you have to do a first routine blood test on all or the proportion again, according to flock size, of animals 18 months of age and older, including billies, and that is due 12 months after passing your second qualifying test. You then have to do a second repeat blood test, and that's due 2 years later, and thereafter a routine blood test every 3 years. So eventually you'll only be doing your blood test every 3 years if it's coming back as negative. Again, biosecurity needs to be remaining a top priority alongside any health scheme. So for further information regarding the schemes offered by SRUC, including the scrapie genotyping, please do look at the website. It's a really good resource and it's really user friendly as well. Thanks for listening. I hope that's been a useful resource for people to be able to see the diseases that we can test for in these accreditation schemes, just to have all the information in one place and a little bit on the schemes themselves and how you can achieve that accreditation status with CAE as a particular example. It's really, again, like I say, just to be used as a tool for you to see the information, make up your own mind about whether or not these schemes are something that you want to look into for your own herds. These are some of the references that I used if anyone's interested in looking into them further. If people have got any questions or would like to discuss anything further, by all means, please drop me an email. That's absolutely fine. And yeah, hope it was useful.